Ask the Expert. Brought to you by UnitedHealthcare.
Women are often juggling their home life, their work life, their community life, so it's easy to see why our health takes a backseat. Mike is here from UnitedHealthcare to talk about this and why it's so important to put ourselves first. Mike, why is it so important for women to focus on our health?
Yeah, well, this is a conversation that I certainly have with my wife, and we have 4 daughters of our own. And so I think it's important for women to prioritize themselves, not only for them and their overall well-being, but also to set an example for the upcoming generation. I think women are more likely to sacrifice their needs for the greater good of the family, and it's very common here in Utah to hear these types of comments.
Yeah, I absolutely do it. I think we can all say we're a little bit guilty of this, of making sure that everybody else is okay, and then maybe getting our regular checkups in last, but as long as like the kids are taken care of and everybody else. So I think it's a good reminder that, hey, you know, we got to take care of ourselves too. And we talk about cancer with women too. Let's speak a little bit more about that.
Yeah, so we've noticed that women not only are more likely to be diagnosed with cancer, it's roughly about 55% more likely to be diagnosed with cancer versus men. But they're also more likely to suffer from behavioral health issues versus men as well. But specifically tied to cancer, I think women need to make sure that they're prioritizing their annual exams. They also need to just be aware of their benefits. A good example of that is as of January 1st, 2026, UnitedHealthcare is rolling out an expanded benefit program.
Awesome.
That really what it does is it allows women to have their first diagnostic screening for breast cancer covered at no cost, as well as colorectal cancer screenings as well. I encourage you to search your benefits to make sure that it is being offered, because it is being offered with select commercial plans. So I would encourage members to verify before assuming that it's covered, but we are rolling out programs such as that.
Okay, that's amazing. That's definitely a big benefit.
Yeah.
What tips would you offer to women who need to make that habit, right? Like we can take that first step, but how do we make it a habit of putting ourselves first?
Yeah, well, I mean, I might go off script a bit here, but I certainly think it starts with diet, nutrition at home, making sure that you're getting necessary sleep. And then from there, it's making sure that you're scheduling those regular exams. Annual exams for mammograms, preventative diagnostic exams are crucial to just keep on the calendar. And then another thing is making sure that you have a relationship with your doctor. Your primary care physician can be a good resource for you to gain information, as well as to be someone that you can trust to gain information for you and your whole family.
Sure, and I imagine, you know, it is crucial to talk to, of course, your healthcare provider about what appointments you should be making and what you should be staying up on yearly. But, you know, can we call UnitedHealthcare and say, hey, look, you know, what am I covered for, if it's a little confusing on what is covered for your health?
Yeah, so I mean, United makes it very convenient for any type of consumer. So you can certainly search it online. You can call in to member services on the back of your card, or you can just visit websites such as uhcopenenrollment.com.
Okay, perfect. Making it easy for everyone.
Yeah.
Women, we got to take care of ourselves, make sure we're doing that. Thanks for the reminders. Great to see you, Mike. Thanks for being here.
Yeah, thanks for having me.